Hello, it's Abbie Palmer, physical therapist at Promotion Physical Therapy in Rapid City. And today I'm just going to walk you through some of the exercises that you could do while you're getting ready for a hip surgery. So the goal of these exercises and stretches is to just increase the mobility of your hip and kind of strengthen around your hip so that after your surgery you have a solid foundation of things to work on with your physical therapist. So your first stretch is going to be laying down. And one by one, you're just going to bring your knee towards your chest. And just hold it for a few seconds at the top. The next exercise is going to be a hip flexor stretch. So there are a couple of different ways that you can do this. The first one, you can be laying down at the edge of your bed or couch, and you can just let your leg hang off the mat. And you should feel a good stretch in the front of the hip there. You can leave this for 30 seconds to a minute. Another way of doing this, especially if you don't feel a good enough stretch laying down, you can be in a kneeling position. Bring one leg in front of the other. Try to tuck your hips under by squeezing your glutes, and you should feel a good stretch in the front of the hip there. And you can lean into it for a greater stretch, or if you feel a stretch just upright, that's good too. Again, hold for about 30 seconds to a minute here. The next exercise is going to be a clamshell exercise. So for this, you will have your legs bent up like this, be laying on your side, and you'll be lifting your knee up towards the ceiling, like that, keeping your feet together. So the most important thing with this is that you're not letting your body rotate to open those hips. Really keep your pelvis, your hips stacked on top of each other, and you're just moving the leg. Hold for a few seconds at the top, and you can do about 10 to 15 of these till you feel some fatigue in the muscles of the side of your hip. The next exercise, you'll be laying down straight, and you will just be lifting your leg up towards the ceiling. The thing to remember about this is to really make sure that you are flattening your knee down and lifting strong, keeping that leg straight the whole time. Again, about 10 to 15 of these till you really feel the fatigue in the muscles in front of your leg. The next set of exercises you will want to do, you can do standing up, and you can do it by any table, counter, back of the couch, anywhere in your house where you kind of have one hand to hold on to. And essentially what you're going to do is you're going to be kicking your leg out in 3 different planes. So the first will be forward. So be kicking out forward there, keeping that leg nice and straight. The next one will be out to the side. The thing to think about with this is that you're not going out to the side and forward. A lot of people will try to kind of cheat because the forward muscles are stronger, but we really want you to be going straight out to the side with this. You should really be pulling with the side of the hip muscles. There. And then the last one will be going straight back. So you can have your hand here, and you'll just be pulling. And this one you won't be able to go very far. You don't have a ton of range here. The main thing you don't want to do is arch your back like that to try to get more motion. So it should really just be a small movement. So it's just coming from the hips and pulling with those glutes there. So the thing about the hip and the knee specifically is that there can be a lot of different factors that are playing into what's going on with your hip or your knee specifically. You can have issues in your low back, you can have issues in your SI joint, you can have issues in your hip, knee, or ankle. You can be changing the way that you walk a little bit, and all of those things can contribute to what's going on with you and making your injury unique to you. So the nice thing about coming to see a physical therapist is that during our initial evaluation, we can take a look at all of these different factors. We look at your body as a whole, and we really examine everything that's going on specifically to you, and then we incorporate that into your overall treatment plan. So it's not really just about the surgery that you had. It's kind of about everything in your body that's making you the way that you are, and we can kind of work on all of those things together. If you have any questions or concerns, or if you'd like to get scheduled for that physical therapy before or after your surgery, go ahead and give us a call at Promotion Physical Therapy, 399-9565.